Thank you everyone for being here for this, which I think is the 4th session of this year's CSC Network Forum. As you will have noticed throughout the week, the sessions this week have been themed around the different pillars of CSC's strategy, which we launched in January of this year. So we had changing policy, changing the narrative yesterday, and changing practice. And today's is really themed around what we call our foundation theme, which is the network, strengthening the CSC network and building a strong foundation for all the important work that you are all doing and that we're all doing with and for street connected children and young people. I'll just go into a little bit of housekeeping. Go to the next slide. So there will be a Q&A session at the end of today's session. Please also feel free to use the chat box at any time to introduce yourself to the other participants, ask any technical questions. If you have any issues with the Zoom itself, then please direct those to CSC Network, which is our amazing technical host, Ellie. Please feel free to share any useful links or resources in the chat box. It will be an interactive session, so I'll be asking you to use the chat box at different times, and I'll also be asking you to use a mural board, so look out for that link in the chat box. Please feel free to tag us on social media using the tag CSC Network Forum 2024, and please note the session will be recorded, so if you're not comfortable being recorded, please leave the session or turn your camera off, and just bear that in mind when you're participating. Okay, thank you. So to give you an overview of the session today, in the first half, we will be talking about impact measurement when working with street connected children. This will be an interactive session, so we'll have an opportunity to hear, learn and discuss with one another. And that will be led by myself chairing, but very much with all of you contributing. And unfortunately, Lucy, our colleague, is not well today, so she won't be speaking or supporting with the facilitation, but we have Harry, who is here on the call, who's our Senior Legal and Advocacy Officer, who'll be stepping in to help with that facilitation. Now, in the second half, we have 3 fantastic speakers who will be talking about one particular approach to impact measurement that CSC has used, and that is Shona MacLeod from University of Nottingham. And many of you may know Shona from her time working here at CSC. Professor Harriot Beazley from the University of the Sunshine Coast, who is a member of the CSC Research Expert Forum, and Jess Hutting, who is from Street Children Rescue and Community Empowerment Program, and she's the program manager there at KDM in Indonesia, and they've worked with Lucy on a most significant change process, and they'll be sharing about that and how that has helped with impact measurement. And then finally, we'll have a Q&A and talk about some next steps for the network. So before I continue, so in 2023, we had held a network survey. So we put a survey out to all of our network members, many of you will remember, and 88 organisations responded. And among those, 45 of those respondents said that monitoring and evaluation and impact measurement was a training need that was not being met in their organisation. And also 32 of those 88 organisations cited showing the impact of their work as a key challenge. So we wanted to put something together to really start a conversation around those challenges, and that's why we're here today, and to look at what we might be able to do as a network to address some of those challenges and support members and each other with evidencing the impact of the work that we do with and for street connected children and young people. Okay, next slide, please. So what do we mean by impact? I think I'm going to start by throwing that straight out to everybody to use the chat box, please, and just put in as many different words or descriptions that reflect what you understand by impact. So please use the chat box to do that now. It would be good to get as many different ideas as possible. And please be as kind of free, as abstract, as prescriptive as you like in what you write in the chat box, but it would be good to get contributions from as many of you as possible. Very simple one to start from Ruth, change. A shared understanding of the change that needs to happen. Positive change, so more specific there from Harriot. Rashi, an impact to find out what we have achieved through our work. Yeah. And can impact be positive and negative? Success stories, intended or unintended change in the lives of project participants. I like that. Rashi, yes, both positive and negative. Learning, Felix, yeah. The changing conditions that result from the things we do. I like that. So it's about, I think, thinking about changing conditions, it feels like that's about something wider than, wider and maybe longer lasting than something more specific. Learning and evolving approaches, yeah. So do feel free to keep contributing those in the chat box or responding to others that they have contributed. So I think all of us will have some experience of feeling that elements of monitoring and evaluation can feel like a chore when they're externally imposed. So I think we've all been in situations where perhaps we've had funder requirements around proving our impact or evidencing our work that have felt like it can get in the way of the real work, which is always really busy and usually under-resourced, especially when we feel like we can see the impact, we know it's working, but we just can't capture it to communicate it to others. And that's a challenge which I've heard time and again from organisations in our network that we work with. But the fact is we have to. So for our own accountability to the children we seek to support and to report to and attract funders, collaborators, and also thinking about those perhaps in government we might be seeking to influence, we need to be able to show that our approach works. So the distinction between outcomes and impact is one that I'll just touch on briefly, and it's one that you'll all be really familiar with from your experience working on this. So outcomes being the changes, benefits or learning or other effects that happen as a result of our and our partners' work. So they can be wanted or unwanted, expected or unexpected. And also some outcomes don't describe a change. They might mean actually an outcome could be keeping a situation the same or preventing something from getting worse or from happening. And they can still describe an effect that your activities have. If the response has not taken place, something else would have happened. So for example, if you did something and delivered a programme that prevented another more negative outcome from taking place. I think throughout the course of my career, I have grappled with the meaning of the word outcomes, outputs, impact at different levels. And I think these are things that are have lots of different definitions and lots of different working uses across our sector. And I honestly think that doesn't end up being terribly helpful for organisations, especially those that are low resourced and working in really busy settings. So I wanted to highlight some of the different interpretations of outcomes and impact. As your contributions reflected, there are different varying understandings and scopes when it comes to impact. So whereas an outcome might be a change occurring as a direct result of what you do, maybe impact is the effect of a response at a higher or a broader level, and perhaps in the longer term. So Ruth, you mentioned conditions changing, which suggests a more sustainable change rather than a one-off outcome. Impact often describes a change in a wider user group than the original target group. So, for example, it might describe a change which is community-wide rather than with the specific group of young people that you're working with. And lots of different organisations and actors may play a part in achieving impact. If there's any, what I'd really love is just to make sure that the chat box is being used. So please come in with your thoughts on this, because this is absolutely not about providing hard and fast answers. It's about starting a conversation, which we will go on to in the next section of this segment. So when it comes to capturing impact with and for street-connected children and the programmes and organisations that seek to support them, there are many different complexities that we need to be bearing in mind. So first of all, street-connected children's lives are complex, and every child and every journey is unique. Street-connected children are some of the most excluded and unheard in the world. So how can we ensure that children meaningfully and safely participate in the design, delivery, monitoring, and the impact measurement of programmes? And we all know that it's especially important to go the extra mile to ensure that street-connected children, who are so rarely involved in decisions that affect their lives, are able to play a role in those decisions that are being made and the programmes that are responding to their needs. So securing street-connected children's rights is not a tick box exercise. I think we will all have experience of that, and potentially of having conversations with funders or partners about the fact that it's not simply as easy as supporting a street-connected child, realising their rights, ticking a box as job done, and moving on to the next one. So our impact measurement approach has to reflect that fact. And in the second half of this session, we'll be looking in detail at one methodology which offers an alternative qualitative way to understand impact that very much rejects the idea that it could be a tick box exercise with street-connected children. We all know that issues such as mobility, the lack of legal identity, the non-linearity of street-connected children's lives, moving on and off the street at different times for different reasons, all affect how we monitor and evaluate the work that we do. And second to that, the binary understanding of on the street or off the street, of either being on the street or in school, of being of the street being unsafe and home being safe, and street versus home, those binaries are really unhelpful when it comes to accurately capturing the impact of what we do. They all promote the removal of the child from a street situation as indicative of job done, but they don't take into account the realities of children's lives, the meanings of their street connections, or a rights-based approach to supporting them. And as you'll know, and I mentioned earlier, organisations working with street-connected children, like many of our network members, are often small, under-resourced, and when it comes to complex or time-consuming monitoring and evaluation systems or impact measurement, that could be a luxury that many organisations feel they can't afford because they're too busy doing the work that is so important to support these young people. So on that note, I'm going to stop talking because I've been talking a lot. And what I'm going to do is put a link in the chat box. And that link is to a mural board. What I'd love for you to do is to visit the mural board, and you will see on the left-hand side of the mural board, there is a section where I'm asking you to capture some of the things which are working well and some of the challenges that you're facing when it comes to impact measurement. These can be organised as either internal, so these are things related to perhaps your organisation, its structure, policies and procedures, your staff team, the design of your programmes, or they could be external, so they could be related to the nature of the street and the context you're working in, for policy context as well, or your funders or funder requirements. And what I will do is share my screen so we can see the mural board. Take a moment to familiarize yourself with the mural board. It's a pretty, if you haven't used one before, it is a quite an iterative, what's the word? Quite a, I can't think of a word, but it's quite an easy system to use once you get your head around it. There's already post-it notes on the mural board. And oh, hopefully you can see now. Oh, wonderful. I can see all of you floating around. We're focusing on the area on the left. So working well and challenges, both internal and external. And I'm going to give you kind of 5 or 10 minutes. I'd love to be able to get as many things on here as possible. Please note you can zoom in by using your mouse, or also on the bottom right of the screen, you'll see that there is a plus sign where you can zoom in like this. I will put this here, so hopefully you can all see that. If you're having any trouble with mural, then give me or Ellie a shout in the chat box. Interactive, thank you, Smita. Yeah, really good points made in the chat here around long-term change in the lives of children and communities, and also showing change in growing lives. A good point from Felix there, that it's never something that happens overnight or within a project period. It'd be great if we could capture that on our challenges board. I always love the allocation of animals to mural board users. We've got visiting owl, visiting cat, duck, spider, lion. Great to see so many of you putting stuff in. So what do we have? We have challenges, lack of human resources to do the measurement. Yeah. Self-reporting on outcomes. Okay, so I think a couple more people have joined. So in case you're confused about what's happening, hopefully you can see in the chat the link to the mural board. I'll just put it in again. Please do go to that link. We are capturing as many things that are working well and challenges when it comes to impact measurement, both internal, perhaps to our organisations, and things which are external, or external factors to consider. So demands of donors that have their own success metrics, I think, is a good one. Which is kind of related to one here. Here we've got that scale. Donors expect quantitative data and high numbers. And I think that's a very common challenge that I've seen. So I'm going to put, Harry is doing an amazing job of organising everything that's going into the mural board. We haven't got much that's going well internally. which is interesting. If anyone's got any more things which are internal to them, which they feel are going well, then please put them in. What's this one here? Sometimes the beneficiaries left the programme before the measurement happened, so we can't get the data. I think that's an understandable challenge. Kind of being able to follow up, and especially related, if we relate that back to the issue of mobility and the non-linearity of many street-connected young people's lives. We can't rely on them to stick around just so that we can get the data we need. Hi, Silvestre, thanks for joining.
Yeah, good morning, everybody. Sorry that I'm late. I have some internet connectivity problem.
No problem. It's good to have you here. So we're doing really well on the challenges. Really well. Having an adaptive model is working well internally. Being locally led. Oops. Just going to put, so floating population, I think I'm going to put that as an external, so that kind of comes with the mobility over here. What else have we got? The challenge, emphasis placed on notions of success which are not relevant to or reflective of local contexts and street-connected children's lives. I think that's a really important one. Lack of secondary data, I think. What do we have in terms of baselines, whether that's as well in terms of pre-existing data sets that can be used as a reference point in our impact measurements? There isn't a lot out there. Great, I'll just give you another minute or so. Not using data sets well, building on existing work. But a thing that's going well is that staff know children individually and very well. So having that kind of one-to-one relationship, perhaps of trust and understanding. Some movement towards adaptive management approaches. That's really positive. And impact measurement as an opportunity to bring our donors on board. I think that's a really good positive spin on impact measurement, and the kind of almost a flip side to some of the challenges is that actually by doing it in interesting and effective ways, like most significant change, you've actually got an opportunity to educate donors a bit. Okay, so what we're going to do now, I'll just let the last few people finish up. And just to let you know, we'll be sharing all of this, writing this up and sharing it back with all of you. We'll talk a little bit about next steps later on. For the next section, what we're going to do is actually go into 2 breakout rooms. I'm going to stop sharing, but do feel free to stay in the mural because you'll be needing it in the next section. We're going to go into 2 breakout rooms now, and I think what I'd like to do is ask breakout room 1, which will be facilitated by me, to focus on internal challenges. So we're just going to focus in on the challenges now, and breakout room 2 to focus on the external challenges. So referring to the mural board that we just populated, having a look through the internal if you're group 1 or external if you're group 2, and that will be facilitated by the brilliant Harry. And we're going to try and capture reflections, ideas, and questions. So we're not looking for answers and solutions only. We also want to know what are the kind of the niggling questions that remain when it comes to addressing these challenges that actually we need to find a way to answer. So when in a moment, Ellie is going to allocate breakout rooms. You'll get something flash up inviting you to join one. So please click accept, and we'll see you over there in the breakout rooms. Thank you for your contribution so far. Thank you for coming back, everyone. Naomi, you were mid-flow when we got kicked out of the breakout room. So if you want to put what you were saying about qualitative measures into the mural, then do feel free on the blue or yellow post-its on the right-hand side. So I'll just do a quick run through of some of the things that we discussed in group 1, and then I'll ask Harry you to do the same. That's good. Thank you everyone for your kind of really honest and constructive contributions. It's really interesting to have all of you together on this. So we talked a little bit about the resources that are required for both monitoring and also evaluation. We talked about the fact that many organisations or partners of organisations won't have dedicated M&E staff, or M&E staff might move on. Perhaps the resources aren't there to retain technical staff, or perhaps evaluation and the functions related to it are actually part of a programmatic role, and you've got an individual or a team who are delivering a programme whilst also trying to monitor and evaluate it. And I think that probably sounds very familiar to a lot of us. Another thing that we talked about is really the understanding of what is required to measure impact effectively, and therefore the ability to budget for it. Kind of not only feeling that we can't go to funders and include big chunky budget lines for this part of our work, but also that we don't actually really know how much to budget for, because sometimes we don't realise until we're doing it that it's a lot more time and resource intensive than we had expected. We talked a little bit about the power dynamic between funders and sorry, my doorbell just went off. We talked a little bit about the power dynamic between funders and organisations. Also, we had good contribution around when you're designing a programme from scratch, and you need to also be designing how you're going to monitor and evaluate it at the same time. And how can we manage the time demands of designing and implementing M&E in a way that doesn't take away time, capacity, or headspace from actually doing the work. And also programs that use more of a casework approach, perhaps rather than a traditional NGO or development approach, are much harder to evaluate or to capture data on in the same way. And really a casework approach is one that takes account of each individual child's journey, which will be different and unique and diverse, and it really speaks to the kind of non-tick box nature of understanding the impact of the work that we're doing. Hopefully I haven't missed anything important. It's all on the mural board, and as I said, I'll be capturing all of this and sharing it with everyone. I'll hand over to Harry.
Thanks, Shona. So we looked at the external challenges and we had some thoughts and questions from that. I think we started off speaking a bit more about, I guess, the broader issues that are out of our control, such as the mobility of street connected children and the impact of unforeseen challenges such as global conflict, natural disasters, those type of things, and understanding that because of the sector that we work in is quite transient, this in and of itself can give rise to quite a few challenges to see impact happening. And then in terms of that as well, I think when we start off programs, there's often issues in terms of what are the measures of success. So trying to have an opportunity to educate donors is a big thing that we spoke about, ensuring that we can make them understand what factors actually relate to success. But even if when we do change that, so obviously we spoke a bit about the old way of thinking in terms of what a success is, a bit more measurable in terms of getting children off the street or into homes. Whereas nowadays, the measures of success we find a lot more to do with empowerment of children, confidence building of children, their ability to advocate. And the issue that rose there was, how can we measure these successes? What are the indicators to measure these success? These things are not necessarily as quantitative as we would have had with, I guess, our old school of thinking. So how can we then make these things measurable so that we can then feed it back and show that there is impact? And the final point that we had is the role of CSC in bringing the network together to respond to these external challenges. How can we work as a collective to bring this forward and highlight the work of our organizations? Because our members do such great work, but often it seems like they're competing when really we're all working together towards the same goal. So how can CSC bring us all together to hear that more loudly and clearly? Again, I hope I haven't missed anything as well.
Thanks, Harry. That's great. It sounds like a really rich discussion. And I think that the point you make around kind of how can CSC play a role, first in highlighting and communicating the impact of the work that the members are doing, but also in convening members to actually together develop solutions to some of these challenges and answer some of these questions, I think is a very good kind of point for us to end this first half of the session. In terms of next steps for the stuff we've done in this first segment, we will be writing up and sharing what we have come up with today together with all of you. And then we'd really love to be able to stay in touch with all of you to think about what we might do next as a network to respond to some of these questions. It's something which was obviously came across really starkly in the network survey, but also in this session today, it's really highlighted, I think, some of the priority areas that perhaps we can get our heads together and do some thinking on. So we'd love to be able to stay in touch with all of you and work together on this as we go forward. Perhaps get back in touch in the new year. I'm going to finish there and hand over to Shona, who is going to now take us through, with Harriot, a really concrete example of one approach to impact measurement, which is most significant change. I'll hand over to you. Thanks, Shona.
Thanks, Sian. Hi, everyone. I am just going to introduce the next half of the session and then hand over to Harriet. We are going to be talking about a technique called most significant change, which is a qualitative evaluation technique which allows organisations to overcome some of the challenges that we've been talking about. So it allows you to capture some of the complexities that are in impact rather than trying to only capture things that fit into pre-designed boxes. So we are going to be talking about using this technique with the working group on women and girls. Some of you may remember all the way back in 2020, which feels like a very long time ago, this working group was started to bring together network members that work specifically with women and girls to give them a space to discuss some of their shared challenges and really to learn from each other. And then one of the things that came out of that group was that there needed to be a way to capture some of the good work and more complicated work that these organisations were doing. So that is what led to the most significant change process, which involved capturing stories from 7 of those network members in that working group and was led by 2 members of the Research Expert Forum, Professor Harriot Beazley and David Walker. So I'll hand over now to Harriet to talk about how that process worked.
Thanks, Shona. Thanks very much for the introduction. And you've also just promoted me. I'm actually an associate professor, not professor, but I quite like being called professor. So thanks for that. Yeah, it was a really great, and I really liked Roz's point in our breakout discussion, talking about the great work that our members are doing and how do we communicate that work. And this approach actually really highlighted the amazing work that our network members are involved in, and working with the organisations that are working with street connected girls and their families through this approach, the most significant change approach, really brought up some really great examples of positive impacts of the organisation's work. And I think it's a nice segue, Ros, that you said, or Harry sort of summarised, saying our members do such great work and how can CSC bring us all together to communicate the work that we do. And the plan with this project is to actually create a paper outlining the most significant change approach with the organisations, and Shona will talk a little bit about that at the end of the session. But I was really pleased to hear Ros ask that question, because that's kind of what we're planning on doing out of this research. So if I could have the next slide, please. So the most significant change approach was developed by Rick Davis and Jessica Dart. And some of you might know the concepts of appreciative inquiry, which is basically looking for strengths in a community, or strengths as a result of a project. So it's a strengths-based approach. And the way that Rick Davis and Jessica Dart created this approach was to capture stories and narratives. So it's a storytelling approach using an interview format to understand what are some of the things that have happened as a result of an intervention. And it's usually as a group, and the stories are collected, and then they define these domains of change. So they sort of try and, as you would with the normal research process, you would decide on themes, on key themes, which are the domains of change within the community. And then you decide on which stories you're going to reflect on, and then bring out the sort of main points of positive stories. So it's a really positive strengths-based approach, and it's really taking an appreciative approach of the good stuff that's happened as a result of an intervention. And what it also encourages practitioners to do is to reflect on their own work and practice, and think about some of the things that they've done, because often we don't have the opportunity to do that because we're too busy working and not really thinking about the impact of our work. And next slide, please. So I've just done a few points here. So it's a participatory method used for monitoring and evaluation, and it focuses on collecting and analysing the stories. So the stories that are collected through that storytelling narrative interview approach, looking for significant change moments from stakeholders. And the great thing about it is that it's valued for its ability to reveal intended but also unintended outcomes, because what we've been talking about so far today is about the about indicators and about measurements of success, and how those measurements have shifted over time from sort of more traditional quantitative approaches to qualitative approaches. But that we also need to consider the fact that sometimes a programme will have an unintended outcomes and positive outcomes, which we can't possibly anticipate, so we wouldn't have created indicators for them. And that's why this approach is really great, because it allows for us to identify those unintended outcomes and positive impacts of a programme, and potentially negative ones as well, through the voices of those involved. Next slide, please. So the main elements of the most significant change approach are, as I said, story collecting or story telling through a participatory approach, and it's really through reflection and dialogue on the through the interview approach. And then once we've got those stories, then we look for domains of change through that discussion, and then we document that, and we go back to the group, and then they give us feedback. So it's a sort of circular motion which then creates this continuous learning. Next slide, please. So this image comes from Davis's and Dart's manual. Some of you will recognise it because it's a little bit old, but it really does speak to what we were talking about earlier. So a lot of indicators are all about measuring, and then, but actually what this approach is all about story collection. So it's about stories about the significant changes that they have experienced or seen due to a project programme or intervention. And these are really personal stories, and they're focused on individuals, but they're also focused on community, and they can be related to systemic changes, external factors, and they are, instead of the quantitative indicators and the targets and the measurements that we were talking about as being old-fashioned earlier on in our discussion in the breakout rooms. Next slide, please. So the approach is, the stories are collected, and they can be at different levels. So it can be at an organisational level, for example, at a non-government organisation. It can be with staff. It can be with community, it can be at a government level, so it can be at any stage, and it can also be at the the community, or in the case of CSC with Street Connected Children, to talk about their experiences of an intervention or of a programme. And the idea is to have multiple levels of stories. So you talk to the beneficiaries, but you also talk to the staff, and you also talk to management to gather this wide range of perspectives on a programme. And then what happens is that the process fosters this sort of understanding of ownership and reflection and deep thinking, which hasn't necessarily occurred because, as I said, people are so busy being involved, or being the beneficiaries, or being the providers of a particular approach. And so participants are actually invited to discuss and determine which changes are most significant and why. Next slide, please. So, as I said, there's domains or categories of change. So for those of you who are used to doing research, what we normally do is we collect data, and then we categorise based on themes. So it could be themes, as we were discussing earlier after the breakout rooms, in terms of empowerment, or well-being, or self-confidence, or feelings of safety, or behaviour change. And then these themes can help identify broader trends and areas of impact by the programme. Next slide, please. And then, as I said, the reflection and dialogue. So there's this opportunity to reflect on the themes and to have a discussion about them and why certain stories were the most significant. And if we want to report this to a donor, for example, when we're looking to explain the impact of a programme, the positive impact of a programme, this is a really crucial stage for understanding different stakeholders' perspectives and for learning from successes or challenges that have come out of the stories, and that can really help to write the narrative in terms of a donor report, for example. Next slide, please. And then, as I said, the report would be a documentation and feedback. So you would have selected stories that you've documented, and then you could share them with funders and other stakeholders, and be used in reports. So you can use quotes, or you can use a particular story that's been given to you as a significant significant change story. And then these stories are circulated for more discussion and further engagement. So as I said, it's a circular approach. Next slide, please. Oh, yeah, I'm going ahead with my slides. So yeah, it's a continuous learning approach. So thinking about the impact and then having a break, but then having more stories collected 3 to 6 months later to see where changes have occurred and if things are so things are sort of events or small details that might be missed in any other process actually get caught up in these stories, and then you see small incremental changes that you wouldn't necessarily be aware of if you didn't engage in this kind of storytelling approach. And then this allows an organisation to track change over time and adapt strategies based on these new insights which are collected over sort of short periods of time. Next slide, please. So I wanted to end this with just a brief description of what we did. So with the Women and Girls Working Group, we focused on the network members working with and for street connected children, girls, and we were very much focused on the NGOs. So this was at the level of the network members, and it was an exercise that we agreed on what stories we were going to focus on. So we decided that we would be focusing on the impact on girls, but also on their families and also their boyfriends, because they were a significant part of the girls' lives. And all the interviews were held in 2022 on Zoom by myself and David, as Shona described at the beginning of this presentation. So here we have just some screenshots from my Zooms with Hira, lovely Hira from Churi in Nepal, and Paul in Kanayara in India. Next slide, please. So these were the Kuranya, didn't pronounce that properly, did I? Karanalaya. Sorry, I beg your pardon, Paul, if you're here. So the MSc participants who participated in this approach were Churi in Nepal and IWI in Nigeria, KDM in Indonesia, Karanalaya in India, New Generation in Burundi, Umtombo in South Africa, and the Wayoni Child Foundation in Sierra Leone. So those interviews took place and they were probably about an hour long and really drilling down on what were some of the success stories of those organisations. Next slide, please. So the questions that we used with these, as I've outlined here, take a few minutes to think about the changes that have happened in the lives of the girls and the young women as a result of your work, of the work of your organisation. What about the changes that have happened in the lives of the girls' families, or changes in the lives of the boyfriends? Are there examples of girls or young women who have managed to deviate from typical survival strategies by doing something different? So this was really looking for, girls that were potentially managing to survive in sort of unexpected ways, or finding, it's been described as positive deviance approach, which I don't really like, but it's really sort of identifying individuals or families that have managed to find an alternative strategy for survival, which it doesn't take the sort of normal routes with other people in that community, which has resulted in their improved well-being, income, less control by boyfriends or family members, for example. So that's really looking for a positive story, within a particular organisation. And then describe a story that represents the most significant change that has occurred while you've been working with the girls and young women in your organisation. And of course, this took place over, a significant sort of period, like an hour or something. So I think probably some of the chats went on for over an hour. Why is this story significant? Where is the domain of change in this story? So, Is it at the individual level? Is it at the family level? Is it at the organisational level, or is it at the community level? So those were the domains of change that we decided to focus on. And again, that really sort of allowed us to look at, you know, to be able to measure impact at different domains. Next slide, please. So, as I said, these were some of the domains: the self, so self-esteem, confidence, empowerment. Those were some of the changes that were reported on during this most significant change discussion. Community, talking about engagement, community engagement, the organisations managing to engage with the community. Community empowerment was also discussed. And then talking about the ability to work with communities gradually and through participatory approaches to appreciate complexities that are occurring in the community. The importance of family was also another theme that really we managed to get a lot of information about, in terms of the importance of the family-centred approach, rather than just focusing on the individual child and the street-connected girl. And then also talking about boyfriends and the importance of boyfriends, and having to offer something to boyfriends, and something, you know, in order for them to be supportive of the intervention, because boyfriends quite often have a lot of power over street-connected girls, and so it was important to include them as well in training and counselling, and also their families. Some of the organisations are working with the boyfriends' families as well. And a really strong one that came through was the importance of adaptability and flexibility for success. So, you know, not just sticking to the, you know, to the original agenda, and being able to be flexible and to change the approach if it wasn't working, or that they could see something was happening that needed to be addressed. So these were the sort of main domains of change that were identified during our sessions. Next slide, please. So what we did then was we created these, as I showed you originally the format, the pro forma. So we talked about the individual level of the significant change story, whether it was at whether it was the young girl herself, or the young woman, or whether it was one of the parents, or if it was a boyfriend or a husband or a partner, and then the household and the community as well. And then also to see whether there were any significant changes that were reported in terms of programs or organisational level, and at the community level. Next slide, please. So what we did then is have a reflection on the process, and actually a network forum 2 years ago, it was fantastic. After we collected this data, we had a session on the actual approach, and there were some really great reflections of the process. And what we've decided now is that we're going to write all of this up. These are just some reflections from the network members who participated. So storytelling is a powerful way to tell everyone what you have done rather than a report. The process made us think more deeply about the impact of our work. When we work, we don't have time to reflect, but it's important to do this for others to learn, I should say, and share about our experiences. This process raises visibility about our work and enables us to share our successes. It made me realise that we must always try and engage with families, including dads, as they are always important. So actually that was an individual who was reflecting on the impact, and actually realising as they told the story that they needed to spend more time working with that particular group. The process made us realise that small incremental changes make a difference over time. Normally we look for the big things, but it's important to look for the small things. Now that quote came from Jessica Hutting from KDM, who's with us today. And what was really great, other than this fantastic stories that she shared with me about her work with street connected girls in Jakarta in Indonesia, was that she then took this most significant change approach and used it herself in further programs at KDM. So at that point, I'm going to hand over to Jessica. And if you could give us the next slide, please. Thank you.
Okay, thank you, Harriet. Thank you, CSC, for this opportunity so I can share our best practice using this method in our evaluation process. And thank you also for CSC and Harriet for introduce this method to us. So this is start from 2022. It's one of our tools to our measurements to measure our impact and evaluation process. So this is what my point of view when we use the most significant change method to our evaluations process. But before that, I would like to maybe a little bit explain about the KDM so we can have the background context about what we are doing at KDM and how we use the MSG to our evaluations process. Next slide. Yeah, so KDM is actually working since 1972. It's kind of old organizations. And we aim to improving children's welfare through safe, innovative, and participative care and education services, improving community awareness, participations through promotions, education, and advocacy on children's rights and protections, especially for the street-connected and the underprivileged children's. Now we are working in the Greater Jakarta, and we have like 3 main programs in our organizations. First is the street children rescue and community empowerment, and then we also have the alternative education, like non-formal schools, and also the childcare, the alternative childcare. And since last year, we also have the young people empowerment that we provide them with the job readiness training. And yeah, we can go to the next slide. And this is the program that we use in the community, in our community program. So we call the program with Program Bola. It's actually stands for Bermain Olahraga Lindungi Anak, means play and sports to child protections. And in 2022, we are focusing in the football program for girls because we are in the preparations for the Street Child World Cup in Doha, Qatar. So we brings the girls teams to that event. And next slide. What is actually Program Bola? So Program Bola works in a number of underprivileged community in Jakarta and Bekasi. And we want to help the children in the communities to have a positive self-image and also avoid the risky behavior. And we do this by collaborations with the local partnership using sports. And we also using this sport to equip the children with the psychosocial skills, especially to them who have limited access to express and also to the to achievement in their community. Right now, the last data of our participants in 2023 is we have more than 500 participants, and there are 20% of girls and then 80% of the boys. And right now we have the most age range is in the 12 until 14 years old. It's 50% of them is in that age range. Okay, and we use the MSG is actually to evaluate the program Bola in the community. So we in this method we are try to use it in the beneficiaries and also implementer partner or our collaboration partner who have joined the programs. It's more than a year. Maybe in the next slide. Yeah. So why we use this MSG to the beneficiaries or implementer program that already joined our program in the, more than a year, because usually when they already join with the programs in a year, they have a better understanding about the program. And also the changing started to seem significantly after a year program, because the regular training of the sports program is like once in a week. So that's why we need the time to choose the beneficiaries that already join with the program in a year. Okay, next slide. Next slide. Okay.
Next slide, someone. Can anyone help?
Yeah.
Hello.
So let me continue. So how the method that we use in this MSG, in the MSG. So we just actually, like what Harriet say, we can use it like in the one-on-one interview context, or maybe in the focus group discussions.
Oh,
Yeah. Yeah, it's fine. Yeah.
We need the next slide, I think, don't we, Jessica? We're one behind.
hi. I don't know if people can hear me. It might be
And
my
then next slide.
internet.
One more slide. Okay.
That's
Then
the
this
one,
is
yeah.
yeah, this is the first method that we use. So we use the interview one-on-one to measure the impact of the holistic program in our evaluations. Usually we use it in the end of the year, and we can ask to the beneficiaries, our beneficiaries, about how they can join with this program, and what about the activities, and then what is the changing that they feel and they see that most happen in their life or maybe in their community, and how the changings occurs, and who's drove the changing. Maybe the coach, maybe the their guardians, maybe the program itself, maybe the module, because we also have the modules, life skill modules in the training sessions. So that's kind of the questions that we usually ask to the beneficiaries. And the last one is, of course, about how we can improve better in the next year. So we can use this input to make the improvement that request or asked by the beneficiaries. Okay, next slide. And we from this MSG, from this interview, we can get some of the key findings, and we can use the quotes of the beneficiary said. Usually we put it also in the report. Like this one is this is the example of the key findings, like the most significant change that they feel they saw happen in their community on or in their individual level is self-confidence, and also the regulations the regulations of the emotions. So from this changing, we also can know how the changes occur. Like for the self-confidence, the changes can occur because of the program itself, the training, and then also the annual competitions that we've made, and the friendly match maybe, or the child conference that we also conduct in an annual as an annual event. And the self-regulations also can be occurred on the individual level, is because the coach, the role of the coach, because the coach taught the children and encourage the participants to manage their emotions, their regulation, especially if they are in the matches. And next, and this is what they tell us about how the program needs to be improved. So they ask us to the program that maybe increasing the frequency and durations and the variation of the method, the training material in the field, like more competitions, increasing the physical training in the training sessions. And next, this is the second method that we use for the MST, is we use the focus group discussion, especially for the girls team that joined with the Street Child World Cup in Doha. So actually it's almost the same with the individual interview, but we emphasize that this is like the group discussion. So it's emphasis in the team opinion. So what we are asking to the girls is like the experience they get during the Street Child World Cup, and then how their community is seeing them after they return from the Street Child World Cup. And of course, what we need to improve if we want to participate in the Street Child World Cup, in the next Street Child World Cup. And then the key findings from these focus group discussions is there are 5 most significant changes that happen in their life. First is about the self-confidence, about the friendship and networkings, because they know friends from other country, and then their public speaking skills, and also their insight, their knowledge about children rights, women rights, and also national and global diversity. And the last one is this opportunity can make them as a role model for their children, for their friends in their community. Okay, next. And what we need to improve if we want to participate again in the Street Child World Cup is like the quality of the training field, and then the more strategy in a football, more English practicing, more public speaking practicing. And then the last one is about the locations of the weekend training sessions, because some of the girls are coming from another part of Jakarta, and it's so far sometimes for them, so we need to have a better locations for them so they can easily reach the locations. And why we try to use the MSG? First, the MSG capture things that number cannot tell, especially on answering why and how questions. And then from this, we can get the depth of the stories and the impact, because sometimes in the quantitative way, it's only in the surface, but by using this MSG, it's more qualitative way, so we can get the depth and the story, the depth of the stories and impact. So it's give the freedom for the beneficiaries to tell their experience during our program. And of course, we can, as a program runner, we can get a better understanding about what beneficiaries' point of view, about the changes that they see, that they feel, they experience, and we can get the insight and input to improve our program, empower the beneficiaries to dig their own perspective, because this is the using the participatory approach. So it gives them more confidence to express their own opinion, especially for the street connected children that rarely have the opportunity to express their opinion, their perspective. And the last one is knowing what we have done is meaningful, because as a program runner, sometimes we are just trapped in the routinity, but using this method, we can like step back for a moment, and then we can get the reflections from the beneficiaries inside, and also have the feeling that what we actually doing is meaningful for them. So that's based on my experience when we conduct the MSG method to the beneficiaries. Okay, and the last thing is about the challenge. The challenge itself is about the time management. In my experience with the qualitative way, sometimes we will spending more time because the stories can be wider, and then we sometimes also wants to hear like what come next from the beneficiaries. So we need to focusing on the data that we will useful for our program improvement. And by using the guidance, like the questions guidance, it would be more efficient in the time management. And also be careful with the interviewer bias, because especially if we are the one who run the program, sometimes we will have like the expectations answer from the beneficiary. So it's be careful about the bias. And then the last one is when we do this to the children, it's good for us to make the questions like easily understood by the children. And also it needs probing skills, like become a good listener, and then also we have a good sense to capturing the key of the keyword and also have the sensitivity, because some of the questions maybe would be sensitive for the beneficiaries. So I think that's all from me. Thank you for this opportunity. I give it back to you, Shona and Harriet.
Thank you so much, Jessica. That was really great to hear some of the good work that you've been doing, but also how you put this method into practice. That's great. So I am just going to round off by talking about what is next for this package of work. Yeah, next slide, please, Shan. Thank you. So we have a couple of outputs planned from what we've been talking about today. So firstly, we being myself, Harriet, Lucy, and some of the members, hopefully, of the working group on women and girls are going to write an academic paper. And the point of that is really to share some of the excellent work that these organisations have been doing with the wider world, because we know anecdotally that there's great stuff going on, but these organisations don't often have the opportunity to talk about it in a way that infiltrates that academic sphere, and that means it can be used as evidence to guide future programmes and convince donors that this is a useful technique as well. So we are working on a paper that we plan to submit in the first quarter of next year to a journal called Children's Geographies. I don't know if there is anybody else in the room apart from Jessica who was involved in that MSc process, but if there was and you do want to be a co-author, then please get in touch with either Lucy or Harriet and we'll talk you through how that's going to work. And then the second output that we're planning is to put together a how-to guide or a toolkit which will talk CSC members through how to apply this approach in their own work with street-connected children. So how are we adapting the most significant change process for that group? So if you have just been listening to Jessica's presentation and thinking, that looks great, how do we do this in our organisation? That should hopefully give you the steps that you need to be able to do that. One thing we are really interested in is what you want to see in that guide. So if you have specific questions or things that you're not sure about, please let us know and we'll make sure that that guide covers that as well. All right, I think that is everything from us. So back to Shan or Harry, not sure.
Thanks, Shona, and I'm sorry about the slides. Ellie had an internet malfunction, so I'm sharing them, and I'm not sure if you can see the slideshow or you can see my PowerPoint screen, but either way, hopefully you've been able to see the last few slides. Okay, now we are due to finish in 2 minutes, but I think I am happy to stay on for 10 minutes if there are questions and comments from participants that are here today. If you have any questions, don't know if Shona and Harriet, if you're able to stay on for a little bit longer in case there are any questions specifically, or Jess, around the most significant change approach, or any.
Yeah,
I'm just going to stop.
I'm happy to stay.
Just going to stop sharing so I can see everyone. That's better. So we have already have a comment from some really great thanks for the presentation coming up in the chat box. We have Zura from AFD in Afghanistan, who would like to be able to share their experience on project outcomes and impacts. I don't know if you want to come off, if you want to share now, Zuri, then you're very welcome to, but I notice you've also provided your contact details, so perhaps we'll get in touch with you. Does anyone else have any questions either about where we go from here on the impact discussion from the first section, or about most significant change for our panelists?
Sorry, I can speak now if you want, but I can also get then engaged through the call, or sorry, through the email. Is it fine? I can speak a little bit now?
Please, go ahead.
Okay, so we run centers for the street working children in Afghanistan, and by today we have nearly 400 street working children engaged in these centers. Since there have been further developments or bans on the education for girls in Afghanistan, there were some challenges that we had faced during the last 3 years. However, we have continued, and this had a significant impact on our program because we could not enroll children above 13 years old into our programs. We do implement food for school, so they come to the centers where they get their daily food, and for most of them it's the only food that they get throughout the day. But they also engage in football and soccer. We had implemented a survey about their the impact that the project had, and I would be happy to share maybe the short report about it later on through the email. But yes, I guess the we have seen that these programs have been very beneficial for the kids because particularly they suffer. First of all, it's due to conflict and the crisis in Afghanistan, and secondly, because of the situation that they face on day-to-day activities that they do on the streets. And the organizations as AFD are very limited in Afghanistan that they would work with the children. So we do focus on not only on education for them, but also we engage some of our partners in discussing the issues about their safety, about trafficking in person, because they're very vulnerable to that. And all these issues. So I would be happy to maybe present the report that we had, and if there will be further discussions, I can engage. Thank you.
Thanks, Zura. That sounds really interesting. I, for one, would love to read that report. So please do share it with us. If you send it to network@streetchildren.org, and then perhaps we can share it with this group when we follow up on this session, so everyone can have a read. Medea, you have your hand up.
Sorry, it wasn't about Zora's, about what Zora just shared. It was more generally about the most significant change exercise. Is that all right?
Yeah, of course.
Okay, so we just, sort of as an organization have been doing things around what we call kind of measuring the most significant outcomes, because we weren't sure if we were actually doing most significant change the way it was meant to be done. So we just, have this process where we kind of where we harvested the outcomes at the end of it. Is that how most significant change works as well? Or now that we have we've developed kind of a set of indicators, does that mean that we're sort of at a different point? Are we phrasing things right? I'm a little bit, are there resources that you could point us towards so we can kind of check ourselves also a little bit and figure out whether we're still doing kind of a most significant change exercise, or whether it is that we've kind of moved in a different direction, just so that we're technically sound. I think if there are any resources that can be shared around the process, that would be very helpful.
Harriet or Shona, do you want to come in on that, or Jess?
Yes, I'm frantically trying to find the guide, which is Rick Davis and Jessica Dart, because that's a really good free access PDF. I'm just trying to find it for you, and then I'll copy it. I'll copy it for you. But I think what you're describing is it's a valuable approach and definitely worthwhile. But I think the difference from what you're describing and for example, what Jessica has just described is it's a process that takes place during the programme rather than at the end of it,
Right.
and then just looking at the outcomes. But I mean, it's definitely a helpful approach to take. Is that it? Is that the MSc guide that you've just put up there? Oh, well done, Shona. You found it.
Thank you.
I'm absolutely shocking at multitasking. I can't speak and look at the same time. So yes, that's it. That right there, that's it, Madiha, and that's a really useful guide that will help you reflect on your own practice, your own processes at the moment, and think about how you might be able to change them slightly. But it sounds like you're doing a really, really great job at that kind of reflection, which is so important.
Thank you. Thank you so much, Harriet and Shona.
Thanks. We've just got a question. I will come to you, Ruth, but I'm just going to go to Rashi first because Rashi put a question in the chat, which is a generic question about MSc. How do we overcome interviewer bias or bias of the staff or management of participating organisations? Harriet or Shona, just to put you on the spot.
That's an interesting question. I mean, I suppose that because it's an appreciative, positive approach, then, you know, you could challenge any of the sort of positive stories that come out of it. But I have to say that quite often when I read monitoring and evaluation reports, particularly when they're written by the practitioners who are involved in the programme to the donors, they're often very rosy coloured spectacles and everything was great kind of approach anyway. So I think it is one of the pitfalls of monitoring and evaluation more generally. But you know, I think because you're looking for stories, and it is a sort of evidence-based approach as well. You're asking for, you know, specific examples of the success of an approach or the success of the outcome at those different domains, so individual or community or family or organisational level. So yes, there may be bias involved, but also you have a positive story and a solid example that you can use through that process. So it's biased to an extent, but also I think it's you stumped me slightly, but I don't think there's anything wrong with that really, as long as the stories are what I found in the process that we did with the network members, that they were genuine. And you know, that was the perspective of the person that I was speaking to. And it actually empowered them. I felt like it really made them feel good about what they were doing as well. You know, it really made, you know, for them to have the time to reflect on their own practice was actually it was kind of a catharsis in a way, and good for them. Yeah.
Thanks, Harriet. I'll go to Ruth. Oh, Jess, yeah, do you want to come in on that?
Yeah, I'm going to add maybe some based on our experience.
Oh,
so
nice.
to
Yeah.
the bias, yeah, to the bias is maybe we can use like I don't know, in our Indonesian terminologies, like a triangle informant. So it's not only maybe from the program, it's not only the children, but also maybe their parents. And then maybe the coach in our context, maybe also the guardians or the what we said about we said is about the implementer partner. So more informant would be decrease like the subjectivity. Yeah, because maybe if only the children and then the interviewer is adult, they sometimes can be like intimidating. So
Yeah,
that's
no,
why
that's a great example.
yeah. So maybe
So
we
it's
can
validating.
yeah, try to find another informant that relate with the beneficiaries. Yeah, I think that's my additional information about the interviewer bias.
Thanks, Jess. That's really, really helpful. Makes perfect sense, the kind of triangulation of inputs perhaps around one particular change. Let's go to Ruth, and then I'm aware we've gone 10 minutes over, so we'll go to Ruth. Zura, I know you've got your hand up. If you want to just put anything in the chat, we'll just finish with Ruth's one just for the sake of time.
Thanks, Sean. I was also going to say about the triangulation, because it's quite an important step in MSc as well, and it's I think recognising that qualitative approaches, it's a subjective opinion, subjective perspectives that are put forward, are emphasised in these approaches, and so collectively the stories are providing a perspective on change which is valid, and they are validated by others, which is important. And all approaches have bias, I guess. So it's, that's it's just the kind of bias I have in recognising that. The question I wanted to ask, though, having used most significant change and adapted it in various ways, and developed a toolkit for small organisations for collecting stories as an evaluation approach, which I'm happy to share. I was just really reflecting when you were speaking about the way in which you can connect the changes that are described in the stories back to programme interventions specifically, or specific elements of programme interventions. Because so often I think donors with other approaches to evaluation are always asking for that causality to be, or often asking for that causality to be demonstrated in evaluations. So I just wanted the speakers could reflect a bit on how, in the process of using most significant change, they've been able to, or not, or have had challenges with, trying to connect those changes and link them back to the specific interventions that have been experienced by people or are being delivered by people, depending on who the stories are being collected from. Does that make sense?
Who wants to come back on that?
Yeah, thanks, Ruth. Yeah, that's really helpful. I'm also really interested in the toolkits that you've developed, and I was just seeing that Roz says that she's at Toybox has also created participatory approach whereby child leaders facilitate collecting stories from their peers, which I think sounds like a fantastic approach. That would be really great to get that information, Roz, and that we can include that in the toolkit along with your examples. Yes, please, Ruth. We don't want to reinvent the wheel if you've already got some. Thank you.
Thank you, everyone. I feel like this is a topic we could all speak on for another couple of hours, but we've already gone over by 13 minutes, so I want to release you all back to your day. Thank you so much to our brilliant presenters, Jess, Harriet and Shona. I think it was so interesting to hear about the kind of the theory behind MSc, and then just to get your amazing, really in-depth example of how you used it. I think that really brought it to life as a methodology, so thank you so much. As I mentioned, we'll be following up on the points that we generated together in the first half of the session, so please do look out for that. We'll be in touch in the next kind of couple of months to maybe think about together what we might do, and we will of course keep you informed on progress around the paper and the toolkit that Shona and Harriet mentioned, and we'll be working on with Lucy over the next couple of months as well. So thank you, everybody. Just a reminder that the final session of our network forum is tomorrow at 1 p.m. GMT, and that is our memorial, Roger Hayes and Maggie Eales memorial lecture, which is going to be delivered by Dr. Rinchan Chapal, who is the Deputy Chair of the Committee on the Rights of the Child, the Chair of SIVAC, and we're very lucky to count him among our Board of Trustees as well. And he will be delivering that lecture tomorrow, followed by Felix, who will be closing off the network forum for the year afterwards. So I hope you can join us for that. Please look out for the link online and in your emails. The link has gone into the chat box there, so please do click to register now if you can make it. Thank you so much, everyone, for your participation, and I look forward to continuing this conversation with all of you.